Now we will begin today's webinar on help paying for care. My name is Madison McMahon Ward. I am the program manager for Triage Cancer. Prior to Triage Cancer, I worked with a number of nonprofits located in the Chicago area, where I hosted several educational seminars on different public health topics and created educational resources for community members. I received my master's of public health from Loyola University, Chicago. And if you would like to read more about myself, you can read my bio available on our website. Today, we will be focusing on resources to help pay for care and some of the practical tips and tools to help rebuild financial health. But before we get into those resources, it is important to have an understanding of financial toxicity and its contributing factors. In 2013, researchers from Duke coined the term financial toxicity. And in their research, they focus on the financial burden of a cancer diagnosis and how significant that burden can be, not only in an acute way, but also the long-term impact of that financial burden. And this isn't just about one's bank account. There is also data on how that financial burden is causing stress, depression, and anxiety for patients and their families. But while this is a relatively new term, it is certainly not a new problem. But one of the reasons it is hard to solve financial toxicity is that there are multiple contributing factors to financial toxicity. And we think having inadequate health insurance is the number one contributing factor. But it isn't just about having insurance. It's also about knowing how to effectively use your insurance. We also think that it isn't just about health insurance and the cost of care, but understanding your ability to work through treatment or take time off can impact your finances. And then all of the things that happen in life that normally impact finances, like relationship changes or moving or graduating, those life changes continue to happen. And they compound the financial impact that somebody is experiencing after a cancer diagnosis. So, in order to effectively address financial toxicity, all of these issues need to be addressed. While we know that understanding how to get and use health insurance is a primary way to avoid financial toxicity, the problem is our healthcare system is so complicated that Americans simply do not understand how it works or how to choose a plan. In fact, only 4% of the people surveyed could define the terms used in a policy. One of the reasons that finding the right health insurance can be so challenging is that to be a truly informed consumer, you essentially have to learn a new language. And we know from multiple studies out there that Americans just don't understand health insurance, and we understand why that is. But I just want you to know that right now, if you're feeling like you really don't understand health insurance as well as you want to, you are certainly not alone. Now, in the United States, there's only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company or getting it through the government. And by that, I mean Medicare, Medicaid, military and veterans plans, or state or local programs. But about 50% of people in the United States still get health insurance coverage through their employer. While it is necessary to know where we get our health insurance from, it is also important to understand the terms that are used in health insurance. Remember, only 4% of Americans understand health insurance terms. So let's go over some together. There are terms that we think are most important for everyone to understand about their own health insurance coverage, regardless of where they get it. So there is the premium, which is the cost that you pay each month just to have health insurance. Even if you never get medical care during the year, you'd still have to pay your monthly premium. It's like having car insurance and then never getting into an accident. But then there are costs that we pay when we go and get certain types of care. So first, we have to pay our annual deductible, which is a fixed dollar amount that we have to pay out of pocket before our insurance even kicks in and starts to pay for our medical expenses. You might have a $500 deductible, or you could have a $5,000 deductible, depending on the type of policy that you have. You might even have a $0 deductible. And then there's something called a copayment, or copay for short. And that's also a fixed dollar amount that you have to pay when you get certain types of care. So if you go to your doctor's office, you might have a $10 copayment, or if you go to a $30 copayment, or if you go to the emergency room, you might have a $200 copayment. The amounts are going to depend on the coverage that you have. And that's different from co-insurance or cost share. And those are two terms that are used in the same way. It's the difference between what insurance companies pay for medical expenses and what you pay for your medical expenses. So you might have a plan where the insurance is going to pay 80% and you're responsible for 20% of your medical expenses. And then an out-of-pocket maximum is probably the most important thing that anyone should know about their policy, because in a worst case scenario, it's the most that you're going to pay out of pocket for your medical expenses during the year. And it's a fixed dollar amount. So you might have a $1,000 out-of-pocket maximum, or you could have a $20,000 out-of-pocket maximum. Again, that's going to depend on the coverage that you have. And the way that you reach your out-of-pocket maximum is that you add up what you pay for your deductible, plus any co-payments that you make during the year, plus any co-insurance amounts that you pay during the year. And when you reach your out-of-pocket maximum, your insurance will kick in at 100% for the rest of the year. So to get a sense of how an out-of-pocket maximum actually works, let's go through this example. Dan has a policy that has a $2,000 deductible. It is an 80-20 plan, and he has an $8,000 out-of-pocket maximum. He has just spent a week in the hospital, and he walks out of the hospital with a $102,000 hospital bill. So, assuming he's had no other medical expenses during the year, how much does Dan actually have to pay for his medical bill? So, first he has to pay that $2,000 deductible, which leaves $100,000. But he has an 80-20 plan, so he's going to be responsible for 20% or $20,000. But remember, he has that out-of-pocket maximum, and he's already paid his $2,000 deductible. So he only has to pay another $6,000 of that $20,000 bill to reach his $8,000 out-of-pocket maximum. So his insurance will kick in and pick up the rest of that $20,000 bill. Now, I'm absolutely not suggesting that $8,000 isn't a lot of money. It is, but it is better than the $20,000 he would have had to pay if there were no out-of-pocket maximum, or even the bill that he started out with at $102,000. So again, the out-of-pocket maximum allows you to plan for that worst case scenario by knowing the most that you're going to pay out of pocket. Now, what I just talked about in these last two slides is actually in one of our animated videos on health insurance basics. So if you think you want to hear this information again, or others could benefit from it, you can certainly rewatch it or share it. Finding the right health insurance plan can feel overwhelming, and it can be especially hard to know how to choose between two or more health insurance options. Now, this exercise that I'm about to explain can be useful when comparing two or more health insurance plans. It works when you're comparing marketplace options or comparing options from your employer, or if you compare what your employer offers to a marketplace plan, and even if you want to compare your Medicare plan choices. And when comparing plans, it can be tempting to just choose the one with the lowest monthly premium. But to figure out how much the plan may actually cost you by the end of the year, you have to do some math. So here we have three plans that are available to this person. There is a bronze plan at $173 a month with a $6,000 out-of-pocket maximum. There is a silver plan at $271 a month with a $2,500 out-of-pocket maximum. And then we have a platinum level plan at $398 a month with a $1,150 out-of-pocket maximum. So assuming that you're going to hit your out-of-pocket maximum during the year, because when we're talking about the cost of cancer care, the likelihood is pretty high of that happening. Can you tell just by looking at these plans how much they're actually going to cost you by the end of the year and which option will actually cost you the least? So it's not a trick question. The answer is on the slide. No, you can't tell just by looking at them. You actually have to do some math. And the way that you do that math is that you take the monthly premium and you multiply it by 12, because that's how much it's going to cost you to have that plan for the year. And then you add that to the out-of-pocket maximum, because that's the most that you're going to pay out of pocket for your medical expenses during the year. So in this example, it turns out that the platinum level plan ends up saving you more than $2,000 over the course of the year. Even though we get that initial sticker shock when we see that monthly premium and it seems so much more expensive, it's actually not. But that's mostly because people don't understand how out-of-pocket maximums work, and they aren't taking that into consideration when shopping for health insurance coverage or comparing their options. So doing the math is incredibly important, but it isn't just about cost. And while cost is important to look at when picking a health insurance plan, you also need to make sure that the plan actually covers your providers and your prescription drugs. When shopping in the marketplace or for Medicare, there are online shopping tools that can help you do that. So when you can enroll in coverage is going to depend on what type of coverage you have. Medicaid applications are accepted year-round, so as soon as somebody would become eligible for Medicaid, they can apply. Medicare also has an annual open enrollment period in the fall, and marketplace plans and Medicare plans are calendar year plans, which means even if someone picks a plan on the very first day of open enrollment, that plan isn't going to start until January 1st. And employer plans can vary because employers can choose their open enrollments, but typically they are in the fall to coincide with the January 1st start date. Over the past years, the annual open enrollment for the marketplaces has been in the fall to buy coverage for the next year. Right now, there is a special enrollment period in the marketplace that is open until August 15th. So if you or anyone you know doesn't have health insurance or doesn't like the marketplace plan that they have currently, they have until August 15th to make changes. And we have more information about that available on our blog. So right now, 80% of people can find a plan in the marketplace with lower monthly premiums. And people at lower income levels can qualify for a marketplace plan for $10 a month or less. So if you are currently uninsured, this is a great opportunity to buy a health insurance plan in the marketplace to access those low monthly premiums. If you already have a plan in the marketplace, you can update your information to see if you could get the same plan for cheaper or a better plan. However, this is not automatic, so you do have to proactively update your information to access those lower monthly premiums. So this is a huge benefit to someone who doesn't have health insurance or who wants to make changes to their plan to purchase a plan in the marketplace with lower monthly premiums. There is also a new COBRA subsidy available. So if you lost your job or you had your hours reduced to the point where health insurance is no longer an employee benefit offered to you, you could get 6 months of COBRA for free. But this does not apply if you left your job. And if you want more information on this, you can visit the blog that I have given you on the slide. But if you left your job and are eligible for COBRA, but it is very expensive, the Health Insurance Premium Payment Program, or HIP, may be useful for you. So this is a state Medicaid program that is an optional benefit offered by some states. And if you qualify for Medicaid in your state, but you also have access to an employer-sponsored plan like COBRA, the state may decide to actually pay your COBRA premiums for you rather than pay for all of your care through the state Medicaid program. And you can find the full list of states that have this program on our chart of state laws and contact information on our state resources page. So thanks to the pre-existing condition protections that are in the Affordable Care Act, we actually have more opportunity to make changes to our coverage than ever before. And so it's very important that people actually review their options every single year to make sure that their plan still works for them. But frankly, most people don't. People sort of pick a plan, they go through all this trouble, and then they're like, I never want to have to do that again. In fact, there's even some data that shows that even someone who gets coverage through an employer and has multiple choices will stay with a plan that has high out-of-pocket costs and isn't working for them merely because they don't know how to make choices to get a better option. And so this is an opportunity to actually make changes every year to improve your coverage. So if you or your patients have a plan with super high out-of-pocket costs, or it isn't covering their provider, open enrollment is when someone can get a better plan. And the good news is that we have more health insurance options than we've ever had in the past. And we also have a number of resources for someone who is trying to make these decisions, including when looking at employee benefits. We also have a checklist that focuses on employee benefits during a job search and things to think about when you're looking for a new job and whether or not that employer has benefits that might be useful. Now, the reality is, even having adequate health insurance isn't going to completely eliminate medical bills. And often people are left feeling like this guy chatting with his friend saying, my doctor told me to avoid any unnecessary stress, so I didn't open his bill. Now, we don't recommend that avoidance coping strategy, but there are some key things to understand about how to manage your medical bills to reduce the financial burden. So there are some things that you can do to lower the cost of your bills before you receive care. And as with many things that we talk about, communication is key. You can ask your healthcare team about what your care will cost. It can feel awkward to talk about money when discussing healthcare, but it is absolutely appropriate to know what treatment is going to cost, and if there are any programs that can help you cope with that cost. Many hospitals have ability to pay programs and discounts or financial assistance. Some may even waive a portion of the bill. Another option is to ask your insurance company if they have case managers that can help you through the process. I caution people to keep in mind that these case managers still work for the insurance company and not for you. However, it can be really helpful to know that you are going to speak to the same human being every time that you call. Now, you can negotiate with your providers before getting care. For example, hospitals have a billing department and even patient navigators that can help you with this. And when it comes to getting lab work done, not all labs charge the same amount. You can get a list of tests that are going to be performed and shop around for the lowest prices. And healthcarebluebook.com is a site where you can put in your zip code and it will give you a fair market value of the tests in your area. If you can, group your appointments together so that you are only paying one copay for your office visit. And this may not always be possible, but you never know until you ask. There may also be times when you can get a generic drug instead of a name brand drug, which may be less expensive, or even a less expensive course of treatment. But if you've never discussed finances with your healthcare team, they might just give you the option that they are used to. But of course, please make sure that this is not a purely financial decision and that you have adequately discussed the generic option with your doctor. We would never suggest taking a less effective course of treatment for financial reasons. So once you've received care, you are probably going to get a lot of mail or maybe even emails. Just from your health insurance company, you could get 3 different pieces of mail. One saying that they have received a claim, one saying that they are processing your claim, and one called an explanation of benefits, which explains how to pay care you are responsible for paying. Now, these EOBs can be a bit challenging to decipher, but if you have questions about billing codes or the cost of things, you should call your insurance company and your provider. Now, this is an illustration of the types of information you might find on an EOB. Every insurance company presents the information in slightly different ways, but generally they all have this minimum level of information. You will be able to tell if this is an EOB because somewhere on this form will appear the words, "This is not a bill." You will also be able to see information about the policyholder and who the claim is for. You will also get some sort of summary of the claim. And then finally, there should be some details about the actual services that are being billed. Many EOBs don't even have words on them. There's just some codes, and people are supposed to be able to identify and understand what it means. And sometimes, even when there are words, it's actually not helpful to understand what it is that you're actually being billed for. That's why it's important to ask questions of your provider or the insurance company. Now, a good EOB will have some information about how much you've paid towards the annual deductible and how much you've paid towards the out-of-pocket maximum, either individual or family, but not always. Then finally, the last piece of information you're going to get is from your provider, and that's going to be the bill. The challenge in this system is that these pieces of communication are sometimes sent via snail mail or email, and they don't always come in that order, which is why it's critical to keep track of the paperwork. Many providers are faster than the insurance company is at sending the bill than the insurance company is at processing the claim. And if someone pays the bill before they look at the EOB, they may end up paying more to their provider than they actually owe. And then they're in a situation where they have to ask for money back from the provider, which is just one additional step. So waiting until you get that EOB before you pay that bill is a good course of action. But communicate that with your provider. So don't wait and have the due date come and go and just never communicate that with them, because then the provider thinks that you just aren't paying, and then maybe they will send those bills to collections. You could just call up and say, "Hey, I haven't gotten my EOB yet. Can you push back the due date or make a note in my file?" And to date, I haven't heard any problems with this strategy. So once you get that bill and the EOB, check it for accuracy. We strongly recommend reviewing your medical bills. Medical billing is a human process, and humans make mistakes. And we've seen all sorts of crazy things over the years. But it is just valuable to make sure that you're actually being billed for the services that you received, and to be on the lookout for an incorrect number of something, like being billed for 11 surgeries instead of 1 because they hit the 1 twice, or being billed for things that may have been ordered but then never happened, like a blood test was ordered and then the provider changed their mind. You shouldn't be billed for that. And if you have extensive bills, consider talking with a professional bill reviewer or medical claims organization, and each review service is set up a little differently. We actually have a new partnership with CoPatient, which is a medical bill management company, and they do professional bills reviewing, can help with appeals and the negotiation of payment plans. And if you sign up by June 30th through this partnership, their services will be free for a year. And you can find more information about this partnership on our website. And we also have a quick guide to managing medical bills and a module on cancer finances on managing finances, which explains strategies for managing your medical bills. Besides reviewing your bills to make sure they are correct, you also may be in a situation where the insurance company is denying coverage for care and not paying anything, but you can appeal that decision. You do not need to take no for an answer if you are denied by your insurance company. And it is very common for people during treatment to end up with a denial from their insurance company. And when that happens, if you have individual insurance or insurance that you get through an employer, we generally have two chances to appeal that decision. And the first is called an internal appeal. And this is essentially where you're going back to the company that first said no and saying, please reconsider covering it. But if they still say no, the second opportunity is an external appeal. And this is where you are able to go to an independent review organization and have them decide whether your medical care is medically necessary and if the insurance company should have covered the claim. Now, I fully recognize that this is one more thing that patients have to deal with, but we have data that tells us between 40 to 60% of all external appeals are decided in favor of the patient. So that means that about 50% of the time when the insurance company says we're not covering this, they're actually getting it wrong. And if patients aren't going through the appeals process, then they are either paying for that care out of pocket or not getting that care because they can't afford to pay for it. So when we're talking about access to care and avoiding financial toxicity, understanding the appeal system is incredibly valuable. Now we have many resources available on our health insurance appeals, and this includes some quick guides. We have a new cancer finances module on health insurance appeals that covers how to appeal denials of coverage depending on what type of insurance you have. We also have a recorded webinar on appeals that we did in May. As I mentioned, we have some quick guides, a health insurance appeals tracking form, and an animated video. And these resources can be found on our health insurance page and our Navigating Healthcare page. So throughout this whole process, people need to stay organized. And again, this is one of those things where it's like, okay, I know I need to stay organized, but it's actually easier said than done. And this is not a great organizational system. But the key is that you pick an organizational system that makes sense for you, like file folders, three-ring binders, electronic files, or a pre-built planner. And there are a few examples that are cancer specific that you can purchase. There are also some electronic services that you can pay for to store this information. It really doesn't matter what system you use. What matters is that you pick a system and actually use it. The paperwork can get overwhelming, but there are strategies to deal with this. And we actually have some excellent recorded webinars from a professional organizer that may be useful. Now, one of the reasons we think people need to keep records of all of this information is certainly for the appeals process. You'll also need to keep them if you're submitting bills to HSAs or FSAs, but also some of the expenses can be tax deductible, which could increase your refund or lower your taxes, but you have to keep those records. Now, if you're in a situation where you owe healthcare providers, try talking with them. We suggest doing this before they turn over any unpaid bills to collection agencies, which can help protect your credit. If you can't make a payment by a due date, ask for more time. Check to see if they would be willing to negotiate a payment plan or accept a lower lump sum payment. For example, if you owe $5,000 but you can only pay $3,000, you can ask the hospital if they will accept that lower payment in a lump sum and forgive the remaining balance. This also applies to other creditors like your landlord, student loan companies, and credit card companies. You would be surprised how flexible creditors can be, especially if they know that you have faced a significant hardship like a cancer diagnosis and that you are trying to make an effort to pay your bills. The motto we like to remember here is it can't hurt to try. One word of warning here. Please be careful when considering paying medical bills by credit card. Most credit cards have high interest rates and you may end up spending more than necessary. It is also not recommended that you take out a loan on your home. For example, getting a second mortgage or a home equity line of credit to pay your medical bills, because you would then turn unsecured debt into secured debt and risk losing your home if you cannot make the payments. Now, there are some consequences if you don't pay your bills and if you haven't set up any payment plans. You may not be able to continue to receive care at that doctor or hospital. You may have your wages garnished, which means that they take money directly from your paycheck. And if you stop paying on a debt that is secured by an item, like a car or a home, you can have that item taken away. And finally, you may have to declare bankruptcy so that your debtors can get what is owed to them. Now, bankruptcy is a perfectly reasonable option for some people, but it is neither free nor quick. And so we want people to understand the bankruptcy process and the ramifications for filing bankruptcy before they jump to that as a solution. Also, it has become increasingly more challenging to discharge medical debt via bankruptcy. So we have more information on our website on bankruptcy, but we also have a partnership with Upsolve, which is a free nonprofit tool that helps individuals file Chapter 7 bankruptcy for free using a web app. And you can think of this as TurboTax for bankruptcy. But even if somebody has done all the right things, there may not be enough money to go around. And that's where financial assistance comes into the picture. But the reason we talk about it here later in the webinar is because there just isn't enough financial assistance to solve everybody's problem. And so by doing all of the things that we've talked about up until this point, we will hopefully reduce the need for that financial assistance. So you could definitely consider asking friends or family or even complete strangers for help. And one way to do that is through crowdfunding, which is something that's become increasingly more popular over the years. And GoFundMe is an example of this. I think it's a great way to engage friends and family as long as someone has thought through the decisions about disclosing your cancer diagnosis publicly. We also want people to think through how getting funds from these crowdfunding campaigns may impact their eligibility for any income-based programs like Medicaid or SSI. And in our quick guide to crowdfunding, we talk about some of the solutions to that problem. You may find that you are paying a lot of money for co-payments on your prescription drugs. And Triage Cancer has a partnership with a nonprofit called Needy Meds to provide this drug discount card. And what you can do with this drug discount card is take it to a pharmacist and say, how much would my prescription drugs cost me if I were to use this card instead of using my insurance? And it might be that it's more or the same, or that the card isn't accepted at that pharmacy. But the important thing is that it starts a conversation with the pharmacist, because they might say, well, this card doesn't work, but there's this other program that might help you. And there are a number of drug discount cards now available. And this card is great because you don't have to register this card, your name isn't on it, and it's completely free to use. In fact, multiple people can use the card, so you can share it with your family and friends. Anybody can use it, so it's also potentially helpful if somebody doesn't have health insurance to ask if a prescription drug would be less expensive using this card. Especially for the healthcare providers on the call today, I really recommend that you take a look at these and consider if this might help your patients who have expensive prescription drugs. But the key to this process is just asking the pharmacist if there is a way to lower what you are paying for your medications. Now, when thinking about accessing financial assistance, it can be start with the type of health someone. Different options may be available depending on the type of health insurance plan you have. For example, if you have a health insurance through your employer or an individual plan through the marketplace, you can access financial assistance from pharmaceutical companies and private organizations. However, if you have a government-sponsored health insurance plan, or you would not be able to take advantage of financial assistance offered through pharmaceutical companies, but you could access financial assistance through private organizations, and you may be eligible for Medicare extra help. And if you are uninsured, you could also access financial assistance from pharmaceutical companies and private organizations. Now, if you have Medicare and you are struggling with out-of-pocket costs under Part D prescription drugs, there's something called the Low Income Subsidy Medicare or Extra Help. And to qualify for Extra Help, you must be receiving Medicare, have limited resources and income, and reside in one of the 50 states or DC. And this program can help pay the premiums, deductibles, and co-payments for prescription drugs. And some states also have something called a state pharmaceutical assistance program, but not every single one does. And I'm giving you the link so that you can go to check out what's available in your state. Now, our tool Cancer Finances provides information on different topics that can impact your finances. But we also have a financial assistance module where you can find information about different types of financial assistance offered by local and national organizations. And these organizations may be cancer specific, healthcare specific, or other types of private programs. And the options on Cancer Finances are broken down by type of financial assistance. So when you go to cancerfinances.org, you will see a page that looks similar to this. You will be able to view all of the different topics we have available and that are related to someone's finances. And from here, you can pick the topic that you would like to learn more about. This is the financial assistance resources topic page, and we have them broken down by many different subtopics, from things like childcare, general living expenses, camps and adventure, transportation, and so much more. We really tried to organize all of the different types of financial assistance that is out there for you. And once you've narrowed down what type of financial assistance you are looking for, you can choose that topic. And then you will be able to see all of the different contact information and a brief summary for the assistance programs that are out there. And while we have done our best to simplify the financial assistance resources, you may need to take a look at the different categories and think creatively, which sometimes means playing a little bit of financial Jenga. For example, we'll get calls from people and they'll say things like, I need help paying for my prescription drugs, but I don't qualify for any of the programs you've listed under prescription drugs. And we say, okay, well, do you have money for your gas bill? And if they say yes, then we ask, do you qualify for financial assistance to get utility assistance? Because if so, then you can get utility assistance and shift that gas bill money to pay for your prescription drugs. And I recognize that it sounds obvious in hindsight, but when we are in crisis and are stressed out about how to access medical care or prescription drugs or pay your mortgage, it is easy to get a little bit of tunnel vision. It is also important to note that you may be eligible for multiple types of financial assistance that fall into different categories. You don't have to just find one financial assistance program and stick to it. You may be eligible for multiple, and that could be very useful when trying to manage finances and access assistance. So that is really what we mean when thinking creatively about financial assistance. We also have a module specifically related to COVID-19 and the different consumer benefits and assistance options currently available to the pandemic or due to the pandemic, excuse me. And there have been all sorts of new programs that are offered by the government, like utility, water, and internet assistance. And some of the financial industry companies have released programs to help people if you're having trouble making those payments. And all of this information is available in the COVID-19 module. And this module is frequently updated. So if you have looked at it in the past, it is worth checking it out again. And we also have information on our blog about these different programs. So I do want to highlight two organizations that provide financial assistance. So HealthWell Foundation can help cover the cost of copays, health insurance premiums, deductibles, and out-of-pocket expenses. And they offer financial assistance through a number of funds based on your medical condition. And you can go to their site and see what medical conditions are covered and what applications are currently open and the eligibility requirements. They also just launched a real-time fund alert portal where you can register to receive instant email notifications to track the status of a fund in real time. So if a fund is closed today, you might get notified tomorrow that it has been reopened and you can apply for help. They also just launched a fund to provide co-payment assistance for behavioral health treatments for frontline healthcare workers who have been impacted by COVID-19. And you can find more information about this and their disease-specific funds available on their website. Now, PAN Foundation also provides financial assistance to help people pay for medication costs, co-pays, insurance premiums, and travel expenses. And they have a number of disease-specific funds available, which you can search for by disease type or by medication. And you can apply online to see if you're eligible. They also have a free web app called Fund Finder that helps you search for available financial assistance by disease type and will show you assistance available from PAN as well as other organizations. And it also gives you the ability to follow a fund to receive instant notifications about when the assistance program opens, and you can learn more about this on their website. So remember, you can look into these options whether you're getting health insurance from an employer, the marketplace, or through the government. Now on cancerfinances.org, we also have a module specifically on managing prescription drug costs that deals with pharmaceutical company and specialty pharmacy assistance programs that may be able to help patients cope with the financial aspect of a cancer diagnosis. And I want to dispel any preconceived notions that someone may have about these programs. We often hear from people that think that these programs only offer copay assistance and are only available to those with a lower income, but that is not the case. Often, these programs offer financial assistance beyond just copay assistance, and they may offer other support services as well. For example, they may have resources to check to see if your insurance will cover the drugs that you are taking. They may provide sample billing and coding information to help make sure that the drugs you are taking are coded properly. They may give you resources to help understand denials and appeal for those denials, and other support resources as well. And if you aren't eligible for their patient assistance options, they may be able to refer you to other appropriate patient assistance options. They may refer you to copay assistance, where, for example, if you are commercially insured, meaning that you have insurance through your employer or an individual plan through the marketplace, you may have a $0 copay for oral medications. Or they may be able to help get access to free drugs, either for Medicare patients by helping them apply for Medicare extra help if applicable, or through other foundations. Or if you are uninsured, they may be able to help you contact the pharmacy to receive a 90-day supply or a 1-year supply of your medication. They may be able to help you find free trial vouchers for any new drugs that you are prescribed. And lastly, they may be able to connect you with help for transportation, lodging, and other out-of-pocket expenses that you may come across during the course of cancer care. Additionally, all of these pharmaceutical assistance programs have different eligibility requirements. Some look at health insurance status or income level, and others don't. So it's important to take a deeper look into some of these programs to figure out what you might be eligible for before writing any of them off, because it's really valuable to make sure people are tapping into those existing free resources. Now, when you go to the Managing Prescription Drug Costs module, you can find the different pharmaceutical assistance programs available, as well as private organizations that help with access to prescription drugs. And to see all of the pharmaceutical assistance programs available, when you are in the module, you can click on the subtopic Other Ways to Help Paying for Prescription Drugs, and then click on Pharmaceutical Company Assistance Programs. And you will be able to see a chart that lists the different programs available by company name, disease state, prescription name, and the name of the program, a phone number to contact them, and the type of assistance that they offer. And you can actually search this chart to find any prescriptions that you are taking to see if there is a program that can help. Now, Pfizer Oncology Together is a good example of a pharmaceutical assistance program. They offer a copay savings program available to those that have been prescribed certain Pfizer Oncology oral or injectable medicines. And the eligibility requirements are going to depend on whether it is for an oral medicine or an injectable medicine, and they provide different benefits like help with out-of-pocket deductibles, copays, or co-insurance costs. They also have a Pfizer patient assistance program, which can provide your prescribed Pfizer oncology medicine for free. And they have specific eligibility requirements, which includes having a valid prescription for the Pfizer medicine for which you are seeking assistance. You must be 18 years or older and reside in the US or a US territory. You must be treated by a healthcare provider licensed in the US or a US territory, and you must meet one of the following. Either you have no insurance coverage or not enough coverage to pay for your Pfizer medicine listed, or you have been denied coverage by your insurer and for that Pfizer medicine after an unsuccessful appeal to your insurer. And then you have to meet certain income limits. And the income limit is 500% of the federal poverty level. And before enrolling in the Pfizer patient assistance programs, patients should be sure to fully use all copay assistance options available to them. And if you meet these eligibility requirements, you are able to get your drugs from Pfizer for free. And this is a huge benefit for people who have been denied coverage for their prescription drug or are uninsured. And then they also have a Care Champion program that you can sign up for free if you have been prescribed a Pfizer oncology medicine. And they partner you with a dedicated care champion that has social work experience and provide you with resources on some of the day-to-day challenges that you may face, including emotional support resources, educational resources, and connections to independent organizations that provide financial assistance. And you can find more information and how to apply for these programs on their website that I've given you on the screen. Now, another example of a pharmaceutical company program is Genentech Access Solutions, which can help you afford a Genentech drug. And on their website, you can see the list of Genentech drugs and select the one that you have been prescribed. Then they provide referrals to independent copay assistance foundations or refer you to a Genentech patient foundation or the Genentech Oncology Copay Assistance Program. And the Genentech Patient Foundation provides free Genentech medicines to individuals without health insurance coverage or who have difficulty paying for their Genentech medicine. And you can visit their site to find their participating medicines and specific eligibility requirements. And the Genentech Oncology System, patients or employer sponsored health insurance with out-of-pocket costs for their Genentech drug. And they have specific eligibility requirements, so you can apply online to see if you are eligible. And the last example I'd like to give you is Janssen CarePath. And if you are prescribed a medication from Janssen, they can help identify help with out-of-pocket costs, whether you have private insurance, government coverage, or no insurance coverage. They provide support with dedicated care coordinators. They conduct benefits investigations and provide health plan coverage information. They can review and explain patients' coverage and out-of-pocket costs for their medication, and they provide patient support resources. And you can go to their site and create an account to learn more about your insurance coverage, set up treatment reminders for certain medications, and more. And you can also apply for their Janssen CarePath Savings Program, which helps eligible commercially insured patients save on their out-of-pocket medication costs. And they don't require an income limit, and you can see the other eligibility requirements on their website. So for people who may be through their cancer treatment and they're really trying to figure out what's next, let's look at some tools and tips to help rebuild financial health. So how does somebody start to rebuild after taking a financial hit? Really, it has to start with taking stock of their finances, and that starts with some information gathering. A shocking percentage of Americans actually don't know the full amount of debt that they have. They know what they owe on their credit card or how much in their mortgage or how much of a student loan they still owe, but they don't actually have a full number. And this is our financial big picture document that we created at Triage Cancer. It's an Excel document that you can download, and you can use the free Google Sheets version of this as well. But it's set up so that as you enter numbers for your assets and then your liabilities or your debts, it actually calculates your total debt, your total assets, and your total net worth. So this can be really helpful to get a big picture look at your finances. Even if you have a financial plan prior to your cancer diagnosis, it can be helpful to review where you are right now. Figuring out what your financial picture looks like can help you decide which of the following steps you should take, if any. And it can also help you identify priorities. Maybe your first priority is finding a job. Maybe you're nowhere near that stage because you have to prioritize opening that stack of bills that you have been too afraid to open. Perhaps you are in a place where you are through the deepest part of it and are ready to start thinking about building your savings or contributing to a retirement plan. Figuring out what your next steps might be is entirely personal to your situation. And to get a clear picture of your situation, consider these questions. What is your current status of your finances? Were you able to keep working through treatment, or did you need to take time off? And how did that affect your financial situation? Now that you are finished with treatment, are you back at work? Were you able to go back to the same job or type of work? Or because of side effects, do you need to look for another career path? And has that impacted your finances? And if applicable, are you still in school? And to understand your financial situation, it is also helpful to think about the answers to these questions. And once you have a sense of the answers, you can then move on to what steps you can take to improve your financial health. And to start doing that, you need to create a budget. Now, this is another one of those things that's super easy for me to say, but actually really challenging to do. And so there are 3 steps that I think people need to take. Step 1 is picking a method, and there are tons of methods out there. So you could use a cash envelope system, which involves putting cash into different envelopes based on budget categories. And those could be things like rent, groceries, or student loans, or maybe even for fun stuff like going to the movies or dining out. You decide exactly what amounts go into each cash envelope depending on your spending goals. And the key is that you'll only be able to spend the cash out of those envelopes for the specific budget category until the next cycle of your budget. Other methods include using an app or a software program or the classic pen and paper method. It doesn't matter which method you choose as long as it's something that makes sense to you. Then the next step is about identifying income, and this part should be easy if you've already done that financial big picture document. And then step 3 is identifying all the expenses. And these are the 6 categories that most people have in their situation. So things like housing, living expenses, transportation, your debt. And then what I tend to hear from cancer patients when they're creating budgets is that they try to be the best version of themselves in their budget. And so they don't necessarily include things that they think aren't worthy. For example, we spoke with one woman who loves to get her nails done every 2 weeks, and it was just the thing that kept her going, but she was embarrassed that she was spending that money when she was struggling financially. But we're not passing judgments on a budget. It's about making sure that you're able to maintain what you feel is important to pay for. And so we found places where she could cut down on other expenses. So giving people permission and empowering them to be realistic when creating a budget can have lots of value. Certainly, there are probably millions of apps out there that deal with finances. These are just a few that we've personally played with. The point I want to make here is that every app has a different goal. And so whatever apps people are using, it needs to match their goal. So is it about budgeting? Is it about reducing debt? Is it about building savings? Because that's going to help you narrow in on which apps might be helpful. Now, you may be uncomfortable or overwhelmed with the idea of doing a budget completely on your own. And we recognize that creating a budget isn't always as easy as it sounds. And sometimes you can be left feeling like this couple. They're sitting at their kitchen table discussing their finances, or I guess they're sitting on their couches. And the husband says, "We can pay off our past and save for our future." as long as we avoid the present. So if you have similar sentiments, a financial planner may be the best option for you. Financial planners work with people of all income levels, so don't feel like you have to have Jeff Bezos' level of money to utilize one. You can visit the National Financial Planning Association to find a planner in your area, and many planners will even provide an initial consultation for free with no commitment. You may also want to consider contacting a consumer credit counseling agency, which can provide you with practical tools such as financial calculators, budget worksheets, and other resources. They may also be able to help you negotiate payment plans or settlements with your creditors. But remember that many debt solutions can negatively affect your credit score. Now, this is another one of those personal decisions. Maybe you know that you will not be needing credit anytime soon because you already have a mortgage and a brand new car. So it may be a smarter decision for you financially to reduce your debt and absorb that 7 to 10 year hit on your credit to reduce your debt now and pay less in the long run. But I urge you to talk this through with a professional before you make the decision, because for many of us, it's challenging to anticipate where we are going to be in life in 7 years. Now, one of the most important things for people to understand about their finances is their credit. We often say that there should be a class in high school on finances and health insurance because we all have to deal with these things, but very few of us are actually taught how to deal with any of this. And one thing that I do want to mention here is that while typically we are entitled to one free annual credit report from each of the three major credit bureaus, because of COVID-19, we actually are entitled to them weekly through April of 2022. And if you want more information to help you understand your credit, you can check out our Cancer Finances module on managing finances. Which leads me to the idea of rebuilding your credit. It can be challenging to raise your credit score if it drops, but it is possible. Also, just because you have a low credit score doesn't mean that you cannot get credit. Each creditor sets their own standards, and some may only look at your recent credit history. So if your bill paying history has improved, they may offer you credit. It may be worthwhile to contact potential creditors informally to discuss their credit standards. There are some ways to build a better credit report. For example, if you have one or more credit cards, make sure that the balances on each card are not more than 30% of the available credit on that card. So for example, if you have a card with a $10,000 limit, try to not have a balance of more than $3,000. Now, dealing with finances in the midst of treatment or when you are experiencing side effects like chemo brain may be particularly challenging. And there are some things that might be useful to consider. Many credit cards, mortgages, utility companies have an option for automatic billing. So if you sign up, you can avoid having to worry about if your bills are being paid. Alternatively, you can consider using your bank's online bill pay system. You still have to go in and manually schedule bills, but this way you don't have to deal with the extra steps of mailing the payments in and trying to keep track of what has been sent out. There is also a record of when something gets paid. Perhaps a bill spreadsheet would be useful. Down one side, it's all of the bills that you have to pay monthly, and across the top, it is the months of the year. So each month, you open the document, put in what you have paid, and that way, it's very easy to see if there is an empty spot for a missed bill. So while we have spent almost 90 minutes together today, this was an overview of some of the things that can help you pay for your medical care and reduce cost. But we have all of these other resources to help support you, including a number of quick guides. Or cancerfinances.org is a great resource to utilize. We have a number of educational blogs on finances, as well as some recorded webinars, including a webinar on Adulting 101 if you want to, kind of get that class that should have been taught in high school about finances and health insurance, and an animated video. We also have a number of estate planning resources, which is a key part of managing your finances, regardless of how much money you have. And we do have an upcoming estate planning webinar in August that I encourage you all to register for if you'd like more information on estate planning. But we have a number of quick guides and checklists. We have an estate planning and life insurance module on cancer finances. We have a number of educational blogs and an animated video series on estate planning resources as well. And if you find that your health insurance isn't meeting your needs, or if you don't have health insurance currently, this is just a reminder that we have that special enrollment period until August 15th if you need to make changes or get a plan. And I hope that the information that I provided earlier in the webinar can help you through picking a plan and comparing options. But I want you to know that we have all of these other resources on health insurance that can be useful for you. And we have a webinar in the fall on understanding health insurance, and is open for that. We also have a quick guide health insurance on cancer finances and some recorded webinars as well.